Americans are anxiously waiting to find out if the FDA will approve COVID-19 booster shots. But the recent push for people to roll up their sleeves for the third time is leaving many with a lot of questions, especially those who only got the one-dose Johnson & Johnson shot. Our team is working to get you answers about booster shots. Vanessa Ruffes verifies if you can mix and match vaccine brands for your third dose. But first, Brian Farrell takes a closer look at whether J&J recipients will need a booster.
Health officials say they still are collecting the data they need to decide if people who got the Johnson & Johnson vaccine will need a booster shot. Part of the reason they still are gathering that information is that the J&J shot didn't roll out until March, which was months after Pfizer and Moderna vaccinations began. Something else to keep in mind, more countries outside the U.S. use Pfizer and Moderna, so officials have more information about how effective the shots are against the Delta variant. That's why people are gearing up for the booster from those vaccines 8 to 9 months after getting the original shots. Now, if the J&J vaccine follows that timeline, a booster shot may not be available for a little while yet, and even if it is, officials don't know if protection from the Johnson & Johnson vaccine will fade at the same rate as Pfizer and Moderna. A study of health workers in South Africa found the J&J shot is highly effective against hospitalizations and deaths from the Delta variant. It also showed breakthrough cases were mild. So right now, we'll have to wait and see what health officials say when it comes to the J&J dose. The Surgeon General said that people who got it likely will need an additional dose.
Another question we are seeing a lot: can I change my vaccine brand for the third shot? This comes as people with weakened immune systems are already getting their extra dose. Vanessa Ruffes went to the experts to find out if you can mix and match.
With another round of COVID shots underway for some, many of you wanted to know if you can switch things up. So we went to the CDC and Novant Health infectious disease specialist, Dr. David Priest, to find out. Viewer Ron S. asked us if those getting an additional dose had to get the same brand as the first time. First, we'll remind you, the extra doses available are only Pfizer and Moderna right now, and they're only for people who originally got Pfizer and Moderna.
Try to stick with the brand of vaccine you got for the first 2 doses, but it's not a hard and fast rule.
The CDC says if you don't know or don't have the original mRNA brand, you can get either mRNA vaccine. So we can verify you don't have to get the same brand for your third dose, but mixing it up is really a last resort. Now, what about Johnson & Johnson? Viewer Lisa B. asked if someone could switch from Johnson & Johnson to another brand for their additional dose.
I think roughly 900,000 people in the country who got Johnson & Johnson have already got an mRNA booster. So I think that's already happening, but there's no official guidance on that yet.
So clearly some people are skirting around official guidance here. But right now, the CDC says it still needs more info here on how safe and effective it is to mix J&J with an mRNA shot. So we can verify, by the official guidance, you can't get Johnson & Johnson and then a different brand. But that guidance could change when more research comes out.
As always, if you see something you want the Verify team to look into, just send an email to verify@13newsnow.com.